Dr. Stewart from Timonium Foot and Ankle Center. I want everybody to come over here and meet Sheila. Sheila, how you doing today?
Fine, thank you.
Good. Thank you for sharing your time with us and sharing this. If we look at her foot right here, this skin looks amazing. You run your finger over there, you can't feel anything. Now, I did not videotape this, and we were saying earlier, we wish you did. But a couple weeks ago, Sheila came in this spot and she had an open wound with her prominent bone. And you had come to me, you were dealing with that for a while, correct?
Yes.
And
I'd had a callus formed. The callus would come off, but this time when the callus came off, it made
a sore.
Ripped this, yeah,
right.
ripped this
so she had an ulceration, and she was not able. You hadn't been wearing shoes for a long time, correct? Right. So she was in miserable pain. And if we took an X-ray here, there is a bone right here, and there is something called the peroneal tendons. The tendons come and insert right here, and unfortunately, this is a very tricky condition to treat, and there are very limited treatment options. And I was very blunt about that when you came in. I said there's only a handful of things to do. So basically, what I told her is this. Option one is we got to get the wound healed, which is what we did. We did some local wound care. We took the pressure off. We wrapped her foot up. We got the wound healed. I said, as far as I'm concerned, you have two options. We can surgically remove this bone, which involves removing the bone, but also the tendon that inserts there requires us to probably augment that, which means that this is not a simple bone removal, okay? Other option was to inject a dermal filler in between her skin and the bone to plump this area out. Now, I'm touching her foot reasonably hard right now, and I'm telling you, before we did this surgery, if I looked at her foot the wrong way,
I'd see stars.
she'd see stars. So, excuse me, I'm gonna swing over here for 1 second. She is in a shoe. You cannot even see anything wrong. And this is a good alternative treatment to surgery. Now, she is very well aware that this is not gonna last forever, and we may need to do it again, but if you can pan up, she's smiling, okay? She was in a lot of pain. So, how do you feel like you did with this?
Did well.
Great.
It was a good choice.
Good. Well, I appreciate you sharing this. Dermal fillers are a great option. They're not the only option, but they're a very good, minimally invasive option that can get people feeling better, get back into shoes, and truthfully prevent wounds. Because if she continued with a wound here, she'd be in a lot of trouble. She can get an infection, a bone infection, we can be in a lot of trouble. So this is one great example of how we were able to keep a wound healed, reduce pain, get someone back into the shoe, and she's the primary caretaker of her husband, correct? Mm-hmm. And we need to keep her moving. So thank you for sharing your story, and we're glad we were able to help you. Thank you so much.
Okey-doke.
Okay.
Thank you.